Good morning. I'm Michelle Corson with Kern County Public Health, and I am here to provide an update on the novel coronavirus and its impacts on our community. I will get started with the current situation. I'll move into the recent developments that happened overnight and kind of conclude with actions our community can take to keep themselves safe during this time. So let's get started with, we still can confirm we have no confirmed cases of COVID-19 here in Kern County, and we have no detected community spread at this time. However, the California Department of Public Health has reported 177 cases and 3 deaths in California. The California counties that have community transmission occurring are Yolo, Solano, Sacramento, Contra Costa, San Francisco, San Mateo, Santa Clara, and Riverside, according to the California Department of Public Health. In Kern County, we continue the monitoring program with travelers that have been in areas that COVID-19 is circulating. They get through one of the 11 airports and they are not symptomatic, so they're able to return home, and we screen and monitor them. We have received 23 names of travelers, and there are 15 that have not required monitoring or have completed the monitoring program. Testing has become much more widely available. I announced that in yesterday's update, but we are unable to provide the amount of testing being done because that is not something that is only coming through our department at this time. But testing is becoming more widely available through those new parameters and guidance that was issued. Recent developments, the World Health Organization declared a pandemic, and this is not an indication that the disease has increased in severity. It is an acknowledgement of how it has spread across the globe. And really, this is a bringing together of the international community that we must respond to this together. It's a time to unify and respond together. Late last night, we started receiving new guidance from the California Department of Public Health. We were on calls late into the evening. They are going on this morning as we continue to adapt and assess some of this new guidance that again has just come out. But to kind of summarize that guidance for you, the California Department of Public Health, to protect public health and slow the rate of transmission, gatherings as described below should be postponed or canceled across the state of California for at least the remainder of the month of March. This is large gatherings that include 250 people or more should be postponed or canceled. This includes gatherings such as concerts, conferences, and professional, college, and school sporting events. Examples of essential events this does not apply to. The goal of this recommendation is to prevent people physically coming together unnecessarily, where people who have the infection can easily spread it to others. This guidance does not apply to activities such as attendance at regular school classes, work, or essential services. If you are in a higher risk category, if you are elderly or you have a compromised immune system, there is some special guidance and precautions. We are following the recommendation of the California Department of Public Health. Always take your everyday precautions like the general public, but if you are elderly or you have a compromised immune system, avoid crowds as much as possible. Avoid cruise travel and non-essential air travel. And if you are in a community where you are experiencing a COVID-19 outbreak, stay home as much as possible. Those are the recommendations for our more compromised immune systems and elderly. And I want to conclude with, we all have a part to play in this ever-evolving situation. we're coming back to the basics. Washing our hands as much as possible with soap and water. Avoid touching your face with dirty hands. Cover your cough or sneeze. Avoid close contact with people who are sick. Stay home if you are sick. And yesterday, we began to launch something that we're very excited about. It's a handshake-free Kern social media outreach. Just to remind everybody, we have a role in this and to come up with alternatives to greet each other. And we are thrilled that we've initially had some of our local leaders join us. And here to my left, you can see everybody from Supervisor Mike Maggard, Mayor Go, Cynthia Zimmer, our district attorney, and our own Sheriff Donnie Youngblood jumped on board with minutes notice to help us get this launched. You're going to see more in the coming days. You're going to see public announcements about this. We are thrilled that our leaders at a moment's notice are joining us to really just let us all know we're in this together. There are everyday steps we can all be taking, and this is moving fast. We're meeting all day long to interpret the new guidance we received late last night. Please follow us on our social media channels, Facebook, Twitter, Instagram. Please visit kernpublichealth.com on a regular basis because this does move fast and we're going to continue to update our community and of course with these briefings that we provide. So with that, I'll open it up for questions. Yes.
Do I understand correctly there was a confirmed case in Tulare County?
I have heard that, yes, from Tulare County. It's not been confirmed by CDPH to my knowledge.
How does that change things if it's correct? How does it change things in Kern County?
It doesn't. We expect to hear more cases. There's more testing going on. It brings the reality that this is happening in California more frequently. So it reminds us to be vigilant and do the best we can to minimize any spread in a community now that we have no known transmission going on at the time.
Is there a certain amount of days that someone who's feeling ill should be allowed to pass or be sure of before they come to make sure they get it? So as to not overwhelm you guys with testing unnecessarily. What are you guys' guidance on that?
So when it comes to testing, if you have come into contact with someone that is a known person that has contracted COVID-19, or you have traveled to an area where there is known transmission, and you become symptomatic with things like a fever, a cough, you would want to call your doctor, not go to your doctor, not go to the urgent care. You would want to call them and say, look, this is what I'm feeling, this is my travel history. Then your doctor will decide if moving forward with a test is appropriate. You cannot walk in anywhere as a citizen and ask to be tested. You've got to go to your doctor first. They are going to utilize the recommendations that have been provided. They are going to make their determination, and then they will usher forward the appropriate, get the samples to the various labs that there are. They keep expanding those testing opportunities. So that's how that would happen and what we would recommend.
So with canceling public gatherings, I know that there's the RV thing this weekend. How is that going to be enforced?
Well, first of all, we won't be enforcing. We will be providing guidance and recommendations, and it is the same guidance that the state is providing to us. So we are announcing today that we are fully supportive of what the California Department of Public Health has recommended. These guidelines just came down, so we are moving quickly. Fortunately, here in Kern County, we have been meeting for weeks with our local partners. We have a great infrastructure of communication going on. So we are now going to move into working with our partners to allow them to join us in taking the recommendations and making their decisions.
Is it true that if the doctor, if someone wants to get tested, that the doctors have to get permission from you guys to get kits?
So yes, we as a public health department, we are consulting with our physicians if they feel that a test is needed and warranted. However, they are able to move forward with a test, but they're not testing, we're not testing. They're submitting the samples to one of the labs, that's where the tests are being conducted. And if there was ever going to be a positive result, it would be the public health department that would be notified immediately and make our community aware.
But do
They
we have
to get
local?
permission first?
Let me finish up, I'm sorry.
But they do have to get permission from you guys first?
Well, there are guidelines that indicate we're to work together, but they have the discretion to utilize and interpret the guidelines that have come from the state, and they have the ability to usher forward that sample if they deem necessary.
Thank you.
Sure.
Do we have local labs testing now?
There are labs that we have that have a local presence. Whether or not they are physically doing those tests on site, I don't know, but those labs are places our local samples are able to go to. Where exactly that's happening, I don't know.
Typically, how long does the testing process take from taking the samples to going to the lab to hearing the results, whether they're positive or negative?
It's really varying. At first, any tests or any samples we usher forward, we're still sending to the state, and we're still doing that with some of the testing. It can take days. We're hearing it can take days. I don't know the definitive answer. I think with every lab, that's going to vary. So at this time, I'm not sure, but I've been hearing 2 to 3 days is an estimate.
Out of an abundance of caution, during that 2 to 3 days, let's say if someone is being tested and waiting for results, let's say if you live with someone, whether a loved one, a child, or someone who is being tested or who's exhibiting coughing, fever symptoms, what do you do as a cohabitant?
Great question. First of all, if you have been deemed a person that is going to be tested by your doctor, you become a person that becomes isolated. And what that means is if you are requiring hospitalization, you're in an isolation environment in a hospital, or you are at home isolation. So if you are a family member, that is keeping someone in a room and staying away from that family member and truly working to keep that isolation in place. There are guidance documents online now to prepare families in case they have to care for a family member that is in this exact circumstance. So we would encourage you to go online and kind of review those documents in a way to prepare your own families.
Is that from the CDC? That's where those
Yes,
guidelines are?
yes.
Okay, yeah, I think there's been some concern about, if a family member is ill, such as a child or a more older person, if, you're gonna have to be present to take care of them. Are you able to sort of give a summary of what those guidelines sort of look like?
Well, every family, what they're saying at this time, and especially for those with the compromised immune systems and the elderly, every family should have a plan in place if someone in your household were to become someone that is being tested for or has tested positively for COVID-19. So it is things like having a room in your house that they could be isolated. It's like having some supplies on hand that you would need to care for that individual. The situations are going to vary so much. That's what I can say as far as the details of the guidance. I would encourage you to look that up because right now I can't really recite them, but generally speaking, it's often what you would do during a flu season even. You're really to avoid being around a family member as well. So it would be very similar guidelines.
Has there been any talk about comparing COVID-19 to other viruses that we've had, like the swine flu or bird flu?
There's been a lot of talk. What we're focused on is really staying what we know to be true now. Things like they're saying strongly, and we're following the science, we're following something that is evolving quickly, and we're learning more every day. But what we know to be true right now, and from the Centers for Disease Control, 80% of the known cases are mild and are going to be symptoms that are not going to require hospitalization, and even a fewer amount are going to result in death. How quickly this is transmitting, there is a lot of discussion. We are not prepared to give an answer to that because we follow the definitive answers by the Centers for Disease Control and the California Department of Public Health. But there is discussion of how fast does this transmit. We are hearing the same things you're hearing. We know it's transmitting. We know the flu is in our community now. We're at still the height of flu season. So the good news is the same precautions we want you to use during flu season, we want you to use now. And those don't change. So that's a good thing.
So speaking of the flu, the symptoms between the flu and COVID-19 are very similar. How do you really differentiate the concern, the need to be tested if you just kind of have like general cough and fever symptoms? How do you know if it's just the flu or
Yeah.
if you should be tested for something more serious?
When it comes to knowing and being concerned about whether it's the flu or COVID-19, the distinct difference is your travel history and if you've come into contact with someone that you know has COVID-19. If those factors exist and you've got the symptoms, talk to your doctor and they're gonna make that decision. So that's really the distinguishing factor. At this point, we can't self-diagnose, obviously, and it's gonna take the test. So those are the steps that we need our community to take. Talk to your doctor, yes.
Hospitals are now, or at least one is measuring people's temperature when they come in, turning people away, say, see your doctor. What about people who do not have doctors, personal physicians?
Elaborate more what you mean by that. If
Someone who doesn't have health care insurance or doesn't have an assigned family physician.
we will hopefully start having conversations more. I think of local groups like our Clinica Sierra Vista and Omni. I can't speak directly to how they're handling that at this time, but they serve a lot of our more vulnerable populations. I would say calling to them if you are experiencing symptoms and you are fearful that you've come into contact with someone. Those are potential areas or places that those folks could, seek assistance.
Is there any guidance for people in professions with more touching, let's say daycare workers or let's say people who work in salons, estheticians, people like that?
The guidance continues to come down rapidly. I don't know of anything specifically about that. I know there are some things that have really been coming down specific to schools and around children. So we're starting to interpret some of those guidelines. We were on calls last night and this morning with local schools. So in the coming days, you are going to see how these guidelines are being interpreted and implemented on a local level. They've hit so quickly. Again, these came down last night. I don't have all the definitive answers. What I will say, we are supportive of the California Department of Public Health's recommendations. We have a fantastic infrastructure with our local schools, our superintendent of schools. We're on daily conversations with them and meetings. So what that's going to look like, the guidance that is coming down the pike isn't definitive right now, but in the coming days, that's going to become clear to all of you.
Amy, now you said that you're not recommending essential places of gathering as far as school and work for cancellation. But moving forward, since things are moving so quickly, can you kind of give some recommendations for small businesses or even larger companies or restaurants and what they can do to prepare for if you guys recommend, let's say the next 24 hours, that everyone should work remotely like they're doing in Washington?
I saw there is some recent guidance that has come down for local businesses. So I know there is some guidance I haven't even had a chance to look at. But the key to this is, it said, I gotta look back at my papers.
What's the source?
I'm sorry?
The source of the guidance you're referring to?
California Department of Public Health. So it was clear here. I'm not aware of any guidance that is saying employment, but it is gatherings of 250 people or more. That's the language that's coming down now. What they're encouraging all of us to do on a regular basis in the workplace, in restaurants, in any other places we would be gathering is practicing social distancing, the 6 foot, practicing staying home if you're sick, practicing good hygiene. those would be applicable at this time in a general way for even us here in this room right now, thinking about those kinds of things. So I don't have a definitive answer because I believe there is guidance online from California Department of Public Health, but that's about the best I can do for now.
Could there ever be a situation, California is a really big state and Kern County is a lot different than, say, San Francisco. Could there ever be a situation where Kern County Public Health doesn't feel that the state's guidelines are appropriate for this county? And so maybe you say, we're gonna do something different.
I don't foresee that happening. We are absolutely in tandem because it's the Centers for Disease Control, it's the California Department of Public Health, and we rely on them to provide us guidance. They have tools and resources, excuse me, and knowledge that we simply wouldn't have as a local jurisdiction. We are part of that infrastructure, really. But, our number one priority is to protect the health of our residents. That means a lot. So as this evolves, how that, if we were to question and be concerned about any of the guidance we were receiving, we have such a good relationship with the California Department of Public Health. We'd have a conversation and we'd address that with them. All right. Last question. One more.
Sorry. How are you working with hospitals? I know, again, everything's changing so quickly, so has anything changed with that in general?
We started working with them weeks ago. They were one of the first that were taking this seriously, saying we need to be prepared. So it is an ongoing, constant flow of information. We're receiving guidelines. We communicate it with them. They're calling us for recommendations on a daily basis. So it's truly just an ongoing communication. Some of them are taking precautions that they see fit, but they have been fantastic. We have appreciated how quickly we all were able to get together weeks ago to start preparing to build that infrastructure of communication. So what that also means is with working with hospitals, if they have a patient that's under investigation, a potential person that's been impacted by COVID-19, we're in communication with them about any of those potential cases, and certainly if there was going to be a positive. So we are working closely. We want our community to know that because it should provide all of us comfort to know that we are all taking this seriously, preparing, but reminding us we have no known community transmission occurring at this time. We have no known positive cases, but we are preparing for that to change in a minute. Thank you, everyone. Thank you.